Thank you so much, Melissa, and welcome everyone to NCCOR's Connect and Explore webinar. Today's program is a spotlight on NCCOR history, formation, and operations, and we'll be talking about lessons learned from and the benefits of using this kind of a collaborative model. There will also be time for two kinds of discussions. The first one will be among our speakers to clarify some points and discuss points of view, and then we will have time to answer your questions. So we look forward to hearing from you by typing in the screen. I'll tell you a little bit more about that in a minute. And at the very end, I'll have a couple of announcements of news about NCCOR. Now, if, as Melissa said, if you have a question for about technical assistance, you can let us know using the chat box to the right. If you're having trouble logging into the webinar but can hear us on the phone, please email us at ncor@fhi360.org. That's ncor@fhi360.org, and we'll work with you to resolve the problem. If you have a question for our speakers that we'll then pose to them after their presentations, please write it in the chat box on the right of your screen. And a final technical note, if you're listening to the webinar using your computer speakers, please turn down or mute your computer microphone. So this will help us reduce any potential for background noise. Thanks so much. We will live tweet during the webinar. If you're on Twitter or other social media platforms, we encourage you to join the conversation using the hashtag ConnectExplore and following at NCCOR on Twitter and at ncor.org on Facebook. Our speakers today, we're very grateful to all of them. The first is Tracy Orleans. She's a senior scientist at the Robert Wood Johnson Foundation, followed by Laura Kettel Khan, who's a senior scientist and advisor in the Division of Nutrition, Physical Activity, and Obesity at the Centers for Disease Control and Prevention. And then Rachel Ballard, who is the Director of Prevention Research Coordination in the Office of the Director, Office of Disease Prevention at the National Institutes of Health. Also joining us will be Jay Variyam, who's Director of the Food Economics Division at the Economic Research Service at the U.S. Department of Agriculture. And finally, last here, but certainly not least, Jasmine, we're so happy to have you, Jasmine Hall Ratliff, who's a Program Officer at the Robert Wood Johnson Foundation. Now, just before we turn it over to our speakers, we'd like to start with a very quick poll. You can submit your answer directly on the screen, and the question is, how familiar are you with NCCOR? Very familiar, somewhat. Not so familiar, not at all familiar. We'll wait just a minute, and we'll have the results. Okay, I think we are about done. It looks like, yes. So it looks like a little over half of you are somewhat familiar with NCCOR, so we're delighted that you're all going to be hearing a little bit more, and we certainly hope it'll be useful. So I'm going to turn it over to our first speaker, Tracy Orleans.
Well, good afternoon. I'm delighted to be on board today to give you all a brief overview of NCCOR and the role it's played in building the field of childhood obesity prevention research. I'm going to start with a top-line overview of the history, mission, and formation, the operations of NCCOR, and trace that back to the time in 2009 when it was formally launched. At that time, RWJF was entering its 10th year of funding for the National Collaborative. Next slide. My remarks today are illustrated, are shared in much greater detail in these two papers that were just published by the American Journal of Preventive Medicine. There's a lot of rich detail here about how NCOR was formed and about the sort of the backstory on both the relationships, the interagency relationships, cross-foundation relationships that were involved in creating NCOR, and also about the inner workings, the mission, history, and operations of NCOR. Next slide. I think I'm going to go back for just a second, which fortunately I can do. The one thing I wanted to say before going on to the next slide is that what triggered the formation of NCOR was the discovery in the 1990s of alarming increases in the rates of childhood obesity and chronic diseases in childhood that were previously associated only with obesity in adults: diabetes, hypertension, fatty liver disease. These findings flagged an urgent need for research and public health programming to reverse the rates of the increasing rates of U.S. childhood obesity, and actually catalyzed national efforts to foster cross-funder collaborations. We were pleased that NCOR was an important part of the first wave of national efforts. Since the early 2000s, the NIH, CDC, USDA, and RWJF, I have to start that over. In the early 2000s, these four agencies, NIH, CDC, USDA, and RWJF, worked fairly independently in our planning and funding to build the field of childhood obesity prevention research. Each organization reviewed its own current investments, its most critical evidence gaps and needs, and research priorities. And you can see the activities that were tied to those reviews. Fortunately, these reviews revealed a complementarity in our focus areas, pointing to the benefits of joining forces in a strategic collaboration to build a field of research that could inform our collective efforts to reverse the rise in childhood obesity. So the opportunity to work together in collaboration we saw as an opportunity to accelerate and deepen our learning. Done. In 2007, the CDC, NIH, and RWJF, the three largest funders of childhood obesity research, began to explore the idea of joining forces, identified scientific leads from each organization, discussed common research priorities, and created a vision statement that guided the formation of NCOR, engaging not only funders but leading U.S. researchers to invest in research that would accelerate our progress in reversing the epidemic that surprised us all. This came somewhat naturally to the members of the collaborative because we'd worked in the past in a collaborative with FHI 360, and a collaborative that proved quite successful in developing and spreading effective quit smoking treatments for U.S. Youth, the Youth Tobacco Cessation Collaborative. So we had a background in collaborating, and we saw how much collaboration meant to building the field. NCOR was officially launched in 2009, and in 2010, the USDA, a major federal funder of childhood nutrition research and national programs, expanded its mission to include childhood obesity prevention, and thus joined the collaborative. The strengths of NCOR reside in the diversity of its members. We vary in our mission, our focus, and how we are structured to interact with our stakeholders. The CDC, NIH, and USDA focused on research on research on food and food and health surveillance, whereas the CDC, NIH, and USDA focus more on evidence-based programs, policies, and services. NCOR members benefited from having a coordinating center, FHI 360, to provide a neutral, centralized management entity to coordinate our investments around a strategic plan, to evaluate the effects of these investments, and then to communicate the work of NCOR members and national research advisors. Next slide. This final slide, defining missions and goals, lists 5 of the major aims of NCOR. And I'm just going to read them to you briefly. These aims persist through the current time. The first, identify, design, and evaluate interventions with promise to reverse the rise in childhood obesity, to prevent childhood obesity. The second, increase and improve surveillance. The early work of NCOR focused a great deal on identifying the prevalence and the drivers of childhood obesity within the U.S., and in fact, we even looked outside of our borders to learn more about how to reverse these trends. The third, improve capacity to conduct research and program evaluation. Our joint capabilities were much more effective than we would have been working alone, and we developed in the process a rich partnership and gained enormous knowledge through regular interactions with co-funders. We also, and kudos to FHI 360, provided national leadership to accelerate implementation through communication and outreach. And the communication components of NCOR have proved really helpful in getting the word out and in also enlisting others to join forces in building the field of childhood obesity research. And finally, we focused on working with non-health partners to integrate childhood obesity priorities. So we were not just working in the healthcare system anymore, but looking at what we could learn from other fields of research and incorporate in our efforts to reverse the rise in childhood obesity. And that included looking outside of our health missions to the social determinants of health that are now much more in currency than they were when NCOR was founded. Hope that's helpful, and I'm now turning it over to Dr. Laura Kettel Khan.
Good afternoon, everyone. It's really good to be here. Whoops, one too many slides. There we go. We need that wonderful starburst slide. What I'm going to be talking about initially is just how we actually function and how the partnership operates. And this is really kind of a lot of the backbone, that structure that holds the partnership together, the day-to-day workings. The partnership is anchored with and guided by a steering committee. As Tracy referenced, we have a coordinating center, which is a contract that we have with FHI 360. We also have an external scientific panel that we lean on to just make sure that we're on track. And we want those outside perspectives outside the partnership's purview of what they think is important in the field, just to, kind of as a checks and balances. And amazingly, oftentimes what they bring forward from their discussions are things that the partnership is already talking about, and so there's lots of synergy there, which is very reassuring. We also, in terms of our management, we regularly try to engage the senior leadership within each partnership agency in terms of our future planning and just kind of going over what we've accomplished, whether it be in the last year or so, to make sure that we're also meeting each partner's priorities in a way that they think is valuable to continue their engagement and commitment to the partnership. And then another area that we have engaged in, not from the initial phases of the partnership, this came out of kind of our maturation process. We realized, or I should say others realized, that they wanted to collaborate with us, but they didn't want to really become an integral partner in what you would consider a day-to-day operations perspective. And so we formed this concept of being a strategic alliance so that other groups can either provide needed funding, financial funding to move in an agenda forward or a priority area forward, and or just their ideas if they happen to be working on something. And I'll talk about that in specific in just a minute. And then finally, and this is really what I consider the heartbeat of the partnership, and it's all the work groups that we form with actual staff members from the various partner agencies who work on the actual projects and drive the ideas that NCCOR is centered on or grounded in. And then what oftentimes is overlooked is the more legalistic part of or component of a partnership, and that's a memorandum of understanding. And what I have found as a scientist at CDC, my agency needs that MOU signed to make sure that we can stay engaged and commit travel funds to go to meetings, to devote staff time to this partnership, and it really has provided the legitimacy that we need. But then it also actually documents those needed kind of nuances in terms of publications and products that the partnership generates and creates. Can someone forward the slide one, please?
You got it.
Oh, thank you. Too many. There you go. Thanks. The big part of partnershiping is ensuring active communication, and as I mentioned, that we're coordinated or we're managed by a coordinating center. But there's lots and lots of things that we've learned about that from the vast past experience that FHI 360 has had in developing previous effective collaborations. But one of the elements that I think people often forget is that FHI, in its role as a coordinating center, is a neutral third party, and so it often plays that role of just kind of adding the glue to the conversations without having any agenda of their own. The third component of this would be what I classify as internal communications, and those include in-person member meetings that we have 2 to 3 times a year. We have these monthly calls, which you're participating in. We have annual reports that are generated that we can share with leadership, and then we do actually pull the senior leaders of the partners together periodically as well. And then one of the strengths of working with FHI 360 is their expertise and innovation in all the different products that they have created for us for our external communications, such as the NCCOR website itself. We have an electronic newsletter that goes out to the field for whoever wants to receive that, whether they're a partner or not. They have an extensive social media outreach. They have Connect and Explore webinars, such as what we're participating in today, which focus on emerging issues for the field and new discoveries as they come up. And then the more traditional venues, such as national conferences, and then publications in peer-reviewed journals. Next slide, please. Oftentimes I'm asked, how does NCCOR actually work? I mean, as a member of NCCOR, a staff member of a particular partner, and it's relatively a simple process, but there is some formality to it. In general, for example, at these in-person meetings that we hold, or at even conferences and things when people see each other, an idea will be generated. And so that is first, that idea or concept is developed by the staff within the member organizations. A formal project proposal, which is only a page long, maybe a page and a half at the most, it's not burdensome, has to have that idea has to have support of it and interest from at least 2 of the partner agencies in developing that concept. That initial proposal needs to be vetted preliminarily, by the steering committee. And the purpose of having it vetted is there's a couple different reasons. First, it needs to guarantee or ensure that at least 2 partner agencies are committed to leading the effort. The steering committee evaluates also if the idea actually fits within NCOR's core mission and goals, and then they'll provide input for other possible staff members within the other agencies that might or should be included, that the original staff who were conceptualizing that idea, they might not even be aware of. And so oftentimes people are pulled in and identified in that manner. And then the final step is for the project proposal to actually be presented to the entire membership of NCOR at a member meeting generally, and they, it's for their approval and just to see if anyone has any significant objections to it. But the biggest part of that presentation is an invitation to participate, because one of the fundamental operating principles of NCOR is that any staff member of a partner agency is invited and encouraged to participate in projects. So all are welcome. Next slide, please. Often, or just to kind of conceptualize how we build our strength, it's through the various types of capital we have. We have social capital, which is often labeled the bedrock of our collaboration, and it ensures those strong relationships and the ability and opportunity to build trust between each other. The intellectual capital is that the diverse expertise within all the partner organizations. The management capital, and that the ability for the different organizational approaches and mechanisms for actually completing that work are coordinated and leveraged. For example, the coordinating center, they actually manage the logistics of a work group, enabling that group to work together and complete their action steps, and even support the project to its final steps. But critical in that is the work group leadership from the staff within each partner. They're the ones who actually direct the work itself. And then finally is financial capital. Oftentimes nothing can happen without money, but we have different types of financial capital or financial support. One is just the annual funding that the coordinating center is provided by each of the different partners. But then we have project-specific funding that is provided by either one or numerous of the partners. And then, as I mentioned, this outside funding, such as through NCOR strategic alliances, such as JPB Foundation is a good example that we're currently working with. But then finally, when you step back and look at this has been a very, very successful collaborative, and it's been acknowledged as a successful collaborative, and it has not gone unnoticed within the agencies in which we work. As a matter of fact, NCOR was one of the original recipients of the HHS Innovates Award for partnership, and so NCOR is known as a model of leadership and having impact on its field. Next slide, please. And then finally, this idea of strategic alliances. I alluded to it in terms of the financial resources. Oftentimes, strategic alliances are needed because they enhance what NCOR's capacity to move the field forward. An example is a current arrangement and partnership that we have with the JPB Foundation that originated with the Measures Registry back in 2015. But that was such a successful project, JPB has agreed to a new expansion of a 3-year grant to develop further not just the measurement users guides, which were based on the Measures Registry, but to take those users guide and actually develop teaching modules. And then a third kind of component of that effort is to examine new measures for specific populations and settings. These are activities that we probably could not have done, at least I know we couldn't have done them as quickly without this outside support of the Strategic Alliance, such as JPB. So now I will pass it on to Rachel Ballard for the conclusion of the presentation.
And just a quick reminder, while we're turning over to Rachel, if you have a question for any of our speakers, if you would just put it in the chat box and we'll get to you at the end of the presentation. Rachel?
Great. Hello, everyone. I think I'm at this end of the presentation because we're about 10 minutes over, so I will encourage everyone to read these great papers. We do want to entertain your questions, so I'll move a little more quickly through some of the things that I was going to be covering. It's important to recognize in the early 2000, as these partners were beginning to talk about this effort, the field of childhood obesity prevention and control research really was in its infancy in terms of addressing the areas that we first focused on, which were really trying to better understand the influence of interventions in this space of environment, policy, and system level changes that were happening and often in a grassroots way at that point in time across the country, if not across the world. So as we move forward, I wanted to just, we are characterizing how NCCOR worked to build this field across several of the principles that were first described by Janice Petrovich. So just a few things to highlight. We work together to identify a common purpose, to create a sense of shared identity and affiliation around that common purpose. As has been described so well, I think, by Laura and Tracy, it was really important to create structures to ensure collaboration. One of the biggest problems we often have is we do collaboration on our volunteer time, which means it doesn't actually move. And so having that structure that helps us work together is very important. It was critical to really identify effective leaders that were capable of helping to move this area forward and to articulate what the need was. We've talked extensively about the incredible value of keeping the field informed and knowledge synthesis and exchange. And we haven't yet spoken, but from the beginning, we've had an effort to support ongoing evaluation, assessment, and feedback loops to ensure continued progress, to correct things if we were not reaching audiences we hope to reach, and to understand where the new needs of the field were. These examples that are on this screen are ways by which we delineated a common purpose. These are the key knowledge gaps that we worked with. And to give you a sense, the effort for creating a catalog of surveillance systems was intended to really help increase use of enhanced and improved national surveillance, because that type of data is particularly used in evaluating natural experiments that were ongoing. So this system is updated and continues to be used, includes over 100 health monitoring systems. In order to enhance capacity for research and program evaluation, one of the big needs early on was to improve the way that we were both measuring both diet and physical activity to try to increase the consistency with which high-quality measures were included so we could actually compare results across studies. The Healthy Community Study and the Childhood Obesity Declines projects were a way to really identify practicable and sustainable interventions, and we had continued efforts to accelerate implementation of evidence-informed practice and policy. Just to give you a sense of one of the projects, we've spoken about the Measures Registry, and that is an online searchable web resource of over 1,200 published studies on validation of diet and physical activity. That's where it is right now. We're currently updating it in part through the Strategic Alliance with JPD, and that will be updated through 2018. It includes measures both at the individual and at the environmental level. Then as people began using it, we were asked, a user's guide would be really helpful because it's not really clear what measure you should use to answer which question. So that was moved forward, as you see, in 2015 to develop the user's guide. Those were released in 2017, and right now we're working on developing teaching modules to reach a range of audiences, from students who are just beginning to practitioners to people who are working in the field. We also are planning to examine diet and physical activity measurement in high-risk populations. Most of our assessment tools are developed for the general population, and the need for modifying those as they work in more specific populations is needed. Another area of great need at the time that we started this effort was the fact that most of the energy expenditure assessments for physical activity in youth that were available in the last time a compendium was developed in 2008 were based on adult values. So recognizing that adult values do not reflect children and really are a problem for trying to understand how physical activity influences the problem of childhood obesity, a group formed, and they really identified 3 areas to work on. One, they worked with experts to understand the need in 2012. Then they came up with a review to understand what was happening in terms of what's the best metric for actually measuring physical activity. Then in May of 2016, they put out a call to investigators around the country for any new data related to physical activities that were done by youth and children, and they published that, and it was included over 100 new energy expenditure estimates that hadn't previously been available. They published this and other papers and ultimately released the Youth Energy Expenditure Guide in October of 2017. Another major area by which NCCOR moves to facilitate knowledge exchange and synthesis is to hold a series of think tanks that are really intended to bring together some of the newest and evolving areas in the field, to bring experts from many diverse fields to talk about what should be done. And these examples here on this slide, I won't read them all, but you get a sense that they deal with food and food markets, with understanding how design and built environment might influence behavior. We've even partnered with groups who are working to improve the environmental impact of buildings, combining that with how do we improve the design of buildings so that they increase ability to adopt recommended diet and physical activity practices. So 2 examples of these with a little more detail. The Green Health Building for Sustainable Schools was co-sponsored by the National Academy of Environmental Design and the U.S. Green Building Council. So these are examples of non-traditional health partners that NCCOR has reached out with to ask for them to work with us together. We all know that addressing the problem of childhood obesity requires multi-sector input, and many of those sectors not traditionally conceptualized as being focused on health, but we all have to be working on this together. Another really creative effort was the Healthy Food Incentive workshops that occurred in 2014 to really understand from practitioners the insights from behavioral economics and working across multiple sectors to understand how we could move forward in those areas. And I believe that is the end. We'll move now to questions.
Yes, thank you all to all of our speakers. This has been really helpful. And if any of you are listening in today have a question for our speakers, some of you have already entered questions, please do so in the chat box. And before we get to those questions, we are going to have a little bit of a discussion from the speakers, all members, past or present members of the NCCOR Steering Committee. So just to be able to discuss a little more some of the lessons learned from NCCOR and benefits of using a collaborative model. Our first discussion question is, what has been the value in bringing together these four organizations that all have different missions and goals? And I think, Jay, you're starting our answer.
Yes, here. Yes. Thank you, Elaine. So this introduction actually touched upon some of these things, but I will just state something that is very obvious, which is that the collaborative really helps break down some of the stovepipes across federal agencies. As they work on the same social issues, but from different perspectives, different sort of expertise, different disciplines, and different approaches. But then all towards the same goal, which in this case is reducing child obesity or informing the formation of policies to reduce childhood obesity. So now, again, the differences come because the agencies are working on different type of interventions or maybe programs, information and education activities, or just the market mechanism. So I think as Tracy touched upon the very beginning, all the partner agencies have been working towards the same kind of ultimate goal, but kind of from a different perspective. And I think the collaborative has really helped to break down that. Now, speaking specifically from an economics agency perspective, one of the biggest benefits of NCCOR has been to know how the public health community, nutritionists, medical communities, to which we don't really have a direct sort of access in our normal work, how they use economic concepts, economic information, findings, and different sort of economic arguments to understand how understand what are the causes of child obesity and how to reduce it. So that has been very insightful. Now, at the same time, it also gives us an awareness of what's missing in some of these arguments or approaches used by other disciplines. So, so that's very important as well, because certainly understanding the incentives, different parties involved in ultimately resulting in these obesity outcomes, whether it is the consumer, whether it is the programs, or whether it is the market, the suppliers. It is important to understand that, and so the collaborative has provided a perspective on what might be missing there from an economics point of view. And I suppose that the same thing applies to other organizations or member organizations in the collaborative. And then ultimately this really helps to be more effective in reaching the goal, the same goal. So I will stop at that and then turn it over to Elaine.
Thank you so much, Jay. And Tracy, I think you're up next.
Yeah, so thanks for those great comments. And let me just add briefly to them. What has been the value of bringing together these 4 organizations? One is we've reached a much larger audience than we would have, any of us would have, working in our silos. So not only do we reach a larger audience, but we've expanded greatly the way we think about, what will work to improve health equity. And I do want to point out, too, that while we don't emphasize this all the time in our communications, most of the grant initiatives and projects you heard about focused in a particular way on underserved or at-risk populations. And so that's another thread that runs through all of our work. And if you stand back and look at it and you condense learnings around what it takes to achieve or advance health equity, you'll find, too, a rich repository of learning. So there's no doubt that we haven't magnified the influence of our grant making individually and collectively by working together. And as you've heard, we've got passionate leaders in the field, those who spoke on the phone today, and our grantees and partners in this work to carry on and spread this multi-funder collaborative approach. We've accelerated our learning, we've had greater impact, and I think we will continue to do that. And our leadership, at least I'm giving RWJF as an example, our leadership has grown with us as we've, for instance, focused on new aspects of improving food streams, food systems, which has not really been mainly in our purview. Those findings make their way back into our work and strengthen it. So I think as a group we're strengthened, and then as individual organizations we're strengthened.
Okay, so thank you both very much. We're going to move to the next question, and we'll just have a very brief conversation so that we can get to some of the participant questions as well. And that question is, what does it take to start a collaborative and keep it going? Now, that's a really hard question to answer in 30 seconds or less, but let's just get some brief comments from Rachel, Laura, and Jasmine.
I think maybe because we do want to get to the outside experts questions, we'll just have maybe 1 or 2 of us comment. So we've already talked a bit about this, early and sustained investment of time and resources, really having a careful planning process. We've reiterated repeatedly about the importance of ensuring that you have an entity that can actually allow the group to meet together, to collaborate, and to communicate. I think scientifically, we have been open to considering evolving priorities as the need arises in the field. So we early on had 4 goals. We added the 5th goal to engage with non-traditional health partners as we continually recognized that this was really a societal problem and we all needed to work together. I'll close and let Jasmine provide her insights on what is needed to really keep a collaborative going.
Great, thanks Rachel. So I would not only emphasize what she just said, but then also add 2 key thoughts. One is, as Laura in her portion of the presentation noted, we have a lot of working groups, and I think having revolving working groups as it relates to the priorities and bringing new voices and new people onto those working groups helps keep fresh ideas moving, in addition to balancing that with a steady steering committee. And the steering committee has been more or less the same people all this time, and so there's been the growth of a mutual respect and admiration for everyone. We genuinely like each other, which helps us work well together and keep the work moving, both in entertaining those new ideas and hearing those new voices, but then also having the consistency of a strong steering committee.
Great, thank you so much. And given the shortness of the hour, Let's go to question number 3. What are some of the challenges you've faced? Laura, we skipped over you on the last question, so if you have a couple of brief comments, and then we'll turn it to Jay.
Hi. The challenge is often, I mean, I think Rachel actually mentioned this briefly in her comments, is the commitment of staff to dedicate time and attention to the partnership itself. It's not something that you can just jump into, you know, like an hour a month. This is hours per week of outside of meeting time, connecting people, thinking about who the best people would be for projects that are going on, and even as a project evolves, what additional people may need to be engaged. And so that's something that the steering committee really focuses on as one of its tasks.
Thank you. And Jay?
Yes, and again, like I mentioned in my first remarks, you know, working across the disciplines is beneficial, but it's also hard due to the different approaches, guiding principles, and disciplinary practices, and so forth. And also the nature of the partner agencies and what they do. You know, some are regulatory, programmatic, some are statistical and research-oriented, and so forth. So, like Laura just mentioned, in that kind of an environment, getting the right sort of incentives for the staff to commit to the goals, common goals, can be a little difficult, or something that has to be managed well, you know, to ensure success. I'll stop at that.
Thank you so much, Jay. And I'm going to turn now to the questions from our listeners. And again, if you have another question, please add it here. And I'm just going to start with an early question. Did you use a specific collaboration model or theory? Janet Petrovich's work was mentioned already, and I would refer you to the set of papers that you can access through these web links or through the website itself, because there's actually a wealth of information in answer to that excellent question. So thank you for that. And then the next one is, can you describe a quick example of how you've used evaluation to feed back into the process? Anybody want to?
Yes, this is Rachel. I'd be happy to answer that. We have done an evaluation on a very regular basis of all the stakeholders. We try to capture that for both researchers and practitioners. We do it for NCCOR overall, but we've also done it for projects. So for NCCOR overall, it has helped us to understand if people are even identifying, you know, NCCOR, where they're getting their sources of information, also what additional types of things they think they need. I mentioned the user's guide. We created the measures registry, and then as we asked people about their ability to use that registry, what they thought was needed, we repeatedly heard from across the field of practitioners and researchers that having some more how-to manual of approaches for selecting specific measures for different projects was a great need, and so we developed the user's guide.
Great. Thank you, Rachel. Did I hear somebody wanted to chime in? Okay, so I'll just also chime in here that you heard about our researcher group that has also provided really great feedback. I know that they have registered frustration sometimes that funders are putting out requests for research that don't really fit what they think needs to happen. So that's the other kind of feedback that has been so valuable to get their insights. So another question, is there an organization that could or has taken on the task of pulling together all the interventions to help states and communities choose the best approaches?
I can take that one on. This is Laura. Actually, one of the, the simple answer is no. Just because the field is so mammoth. But NCCOR has played a significant role in terms of implementation science through a collaboration that focused on the SNAP-Ed program for USDA, where they, the SNAP-Ed program invited NCCOR to help them bring in non-SNAP ed, non-SNAP expertise from the field of obesity prevention at the population level to develop their SNAP ed toolkit, which is a document that highlights all sorts of different interventions and the level of evidence that exists for those types of interventions, as well as their evaluation framework, which goes more into the evaluation, research, and measurement side of things that complements that. And so we have attempted to do that as best we can, not just, but that's one example.
Great. Thank you, Laura. And I'm just going to go right on to the next question. Does NCCOR operate with shared values among all partners and engage in changing systems, policies, and structures that impact childhood obesity, such as structural racism?
This is Rachel. I'd like to remind the group that NCCOR is working together primarily to advance our research and our evaluation efforts to learn from what is happening now. We help, we believe, to change much of the environmental policy and system level factors through supporting research that identifies which of those kinds of practices and policies really work. And then other partners, CDC and USDA, are engaged with implementing the most effective programs to ensure that we get the best results. So we do it by, we're not all doing the same things because our missions are different, but we are integrating our efforts so we feel that we will ultimately have a larger effect.
Great, thank you. And on to the next question. This is from Diane B. How does the Obesity Medicine Association and American Academy of Pediatrics fit into NCCOR structure, if that's applicable?
I can answer that for the American Academy of Pediatrics. For the last couple of years, we've had a project that's specifically looking at how healthcare systems are interacting with the community to address this challenge of childhood obesity. We recognize this was an area that American Academy of Pediatrics was very knowledgeable about, had a strong interest. So we contacted them to both learn what they were doing, but to also work with us in this effort. And so they have been partners with us in workshops and some ongoing efforts we currently have to move that area forward. And we do this in many of our other projects. We do a large effort to find out what's currently existing in the field and then asking other groups if they'd like to work with us in moving forward in effort.
Thank you, Rachel. And just one final quick question. I want to point out we're not getting to all of the questions. We're just very happy that you are asking them, but we will be able to share answers to all questions as a follow-up to this webinar on email. So final question, can an individual collaborate with NCCOR or must they be a part of a partner organization?
By individual, I'm not quite sure what I mean. Number one, individuals like academics and practitioners can join the NCCOR listserv to find out what NCCOR is doing and be kept abreast in that sense. But the meetings and such, for the most part, are targeting the staff of the partners themselves. But the projects, the individual projects, oftentimes have workshops on the on a particular topic, and then non-member attendees participate in that way. I hope I answered your question.
Thank you so much, Laura. And we are out of time. Just a quick plug for the Childhood Obesity Declines Project Supplement to childhood obesity. We urge you to go to the NCCOR website to find out more about these 6 papers. And please, if you have other questions about NCCOR or upcoming activities or have any trouble accessing the resources we have mentioned, please email NCOR at FHI360. We're very happy that you joined us today. We hope that you will let your peers know that this webinar has been will be archived on the NCOR website, and the slides will be available as well. Thank you so much again, and we hope you have a lovely afternoon.
This